On Channels Television, I'm Millicent Walker. Here are some of the highlights this hour. Today, May Day, amidst pandemic, NLC President warns against massive sack. Presidential Task Force gives kudos to Nigerian frontline health workers as WHO announces vaccine development globally. And our theme this evening, the need for more bed spaces as pandemic nears 2,000 mark in Nigeria. State governments as well as the federal authorities are expanding their isolation facilities to accommodate new cases. It has been a struggle in Lagos and the Federal Capital Territory with reports of limited bed spaces. With a call by the Presidential Task Force for attention by the states to explore means of creating more centers for isolation spaces, states like Edo, Lagos, among others, have sprung into action. We look at the challenge getting more bed spaces available to treating COVID-19. The total confirmed cases of coronavirus in Nigeria stands at 1,932. The Nigeria Center for Disease Control (NCDC) also confirms that 319 patients have been discharged, a total of 58 deaths recorded. A state-by-state breakdown puts Kano with 219 cases in second place after Lagos, that now has 976. Abuja has 178 cases, followed by Gombe 76. Borno has 66 cases. Ogun 56, Edo 44, Katsina 40, Bauchi 38, Sokoto 36, Kaduna 35, Osun follows next with 34, Oyo is at 23, Akwa Ibom 16, Rivers 13, Kwara 11. Other states, Ondo and Delta, have 9 each, Taraba and Ekiti 8 each, Jigawa has 7, Bayelsa 5, Zamfara State 4, Nasarawa and Enugu have 3 each, Abia, Niger, Adamawa, Ebonyi and Kebbi have 2 cases each, while Benue, Anambra, Plateau, Imo and Yobe states have 1 cases each. The Presidential Task Force began its daily briefing today with lots of praises for the Nigerian workers, particularly Nigerian health workers. The Secretary to the Government of the Federation, Mr. Boss Mustafa, explains that the role played by the medical officers is one that will always be remembered post-COVID-19 era. He asked employers to develop new strategies for workplace experience and enhanced efforts towards ensuring that they are protected.
The atmosphere for this year's celebration, more than anything else, forcefully reminds us of the disruption to our hitherto normal way of life and challenges us not only as workers, but also as citizens, and to leave no stone unturned in our efforts to return to a semblance of normalcy. The reality is that our lives and the way we knew it can never be the same again post-COVID-19. This year's labor theme, maintaining safety and security in the workplace, further emphasizes the importance of ensuring that all Nigerian workers are adequately protected to increase their productivity. Similarly, it places on the workers the obligation to take responsibility by adhering to the implementation guidelines that have been developed and circulated, especially in this COVID-19 era. As mentioned earlier, the guidelines for phase 1 of the eased lockdown has been released. We urge all states to adopt them and ensure the creation of awareness and compliance. The Presidential Task Force will be meeting with the security agencies this weekend to fashion out modalities for enforcement. Finally, I've been encouraged by the feedback from Nigerians on the need to deepen research into COVID-19 so that a homegrown cure could be found. Part of the mandate of the Presidential Task Force is to build a strong base for research. I therefore urge our scientists and researchers to come up with their findings and follow the validation protocols.
From the Minister of Health, Dr. Osage Hanire, the federal government is still concerned about the situation in Kano State and is working on consolidating efforts that are already in place. He also raised concerns over other diseases this period, saying that hospitals should not refuse to treat patients.
Ladies and gentlemen,
but the tribute I pay today is to the workers of our healthcare system. Doctors, nurses, lab technicians, scientists, and unsung heroes like cleaners, drivers, clerks, ad hoc staff are the Nigerians in the front line. A multi-sectoral team of 14 specialists comprising of persons from NCDC, NPHCDA, that's the National Primary Healthcare Development Agency, the Department of Hospital Services, the Department of Family Health, infectious disease specialists from IROA, media, and the special advisor will leave for Kano in the early morning to support that state in all areas of response. The main focus of intervention is on training, and capacity building of state healthcare workforce along the various specialties on a very massive scale.
And the World Health Organization's country director, Dr. Fiona Braka, has been speaking on vaccines under trial for COVID-19. She said about 89 vaccines are currently in development globally and 7 in clinical evaluation. Dr. Braka also spoke about Nigeria's willingness to join the Solidarity clinical trials to help find effective treatments for COVID-19. Until there is sufficient evidence, the World Health Organization cautions against physicians, medical associations recommending or administering these unproven treatments to patients with COVID-19 or people self-medicating with them.
We have a total of 89 vaccines that are in development globally, including 7 in clinical evaluation and several therapeutics are in clinical trials. WHO is committed to ensuring that as medicines and vaccines are developed, they are shared equitably with all countries and people. We do have the Solidarity trial that some of you may have heard about. It's an international clinical trial to help find an effective treatment for COVID-19, launched by the WHO and partners. More than 100 countries have joined the Solidarity trial, and to date, over 1,200 patients have been randomized from the first 5 countries to evaluate the safety and efficacy of 4 drugs and drug combinations. Nigeria has also expressed interest to be part of this Solidarity trial, and efforts are underway to start the process in Nigeria.
And Lagos State is getting more isolation centres to cater to more COVID-19 patients in the state, as the Governor, Babajide Sanwo-Olu, today commissioned another isolation and treatment centre at Gbagada General Hospital. Governor Sanwo-Olu says the 118-bed isolation facility will be manned by highly skilled volunteer health workers trained in infection prevention and control, as well as COVID-19 case management. Also, the University of Benin Teaching Hospital is ready to join the list of COVID-19 testing centres in Edo State as early as next week. The Governor, Godwin Obaseki, gave the assurance to residents after inspecting the molecular laboratory and other facilities at the isolation centre. He promises that his administration will continue to partner with health institutions to curb the spread of the coronavirus. Now let's assess our capacity to expanding our isolation centres, increasing our bed spaces. We have joining us a public health physician in Lagos, Dr. Samuel Okerinde. Thank you for joining us.
For having me.
And from the United States, Bloomington, Illinois, Dr. Donny Ibeke, a medical doctor, joins us as well. Thank you, Dr. Ibeke, for joining us.
Hi, thank you for having me.
All right, let's begin with you, Dr. Ibeke. Tell us first how the U.S. is battling the pandemic, taking such a huge chunk of the global figures of confirmed cases.
Yeah, so you're right. Unfortunately, we're number one, and in a bad way. We have reached the 1 million case mark as of yesterday and over 60,000 deaths. So the numbers are still rising. The response has been mixed. Some states are easing the lockdown while others are expanding it. But what we can all agree on is that the testing capacity isn't where it should be and needs to increase. And a lot of the governors are stepping up to procure their own testing to help with this public health crisis.
Dr. Ibeke, with bed spaces, how is the U.S. coping with that? In Nigeria, we're recording about 3,500 bed spaces available so far with our numbers, yet we're also feeling the pinch, especially in Lagos and some other states.
Yeah, I mean, this has been the running theme all over the globe. This disease overwhelms healthcare systems. So, in our hotspot areas in the United States, you're seeing emergency rooms filled to the brim, patients overflowing into the hallways. So we've had to make makeshift areas. Central Park in New York was converted. The Naval Hospital ship has been based outside of New York to help deal with overflow. In Chicago, the McCormick Place, which is a big convention center, has been converted to a hospital. And then some places are diverting patients to less affected areas to help deal with this. But it's important to, find ways to, or find places that you can use, because this disease will overwhelm the healthcare system. So Nigeria is not unique at all.
All right, let's come to our guest here in Lagos, Dr. Karen Day. Bed spaces. I mean, you're in Lagos. You observed, that we have limited spaces. How do you think we can get past it? We also have, the isolation centers, like what the governor, flagged off today, opening another isolation center. But then there's also what the NCDC DJ has said, home care. How will that work?
Okay, thank you so much. We need to know that before the pandemic started, we've always have this perennial shortage of bed spaces. Sometimes you go to the ER and they tell you there's no bed space and they have to refer you. So it's really not unexpected, actually. But with COVID-19, like I've seen in other part of the world, in some European parts, you see a lot of patients, COVID-19 patients staying on, by the walkway. But I think that with what we've seen so far, with particularly what Lagos State government is doing, we just talked about the new Bagada isolation center they just opened. Lagos State, of course, is doing so much to be able to handle the bed scarcity and the shortage in bed space. However, there's still so much to be done. Particularly if you compare if you see the numbers that we currently have, we have by today, I'm sure we'll probably be having 2,000 cases, with Lagos probably getting to 1,000. There's still so much that needs to be done.
When you say so much, how much more? People should open their homes so that, these spaces can be used. Okay.
And what other government, of course, what Lagos State, of course, have also done is the Onikon Stadium have been converted to an isolation center. We have one at Landmark. We have one at Bagada. There is a need for us to particularly convert those public spaces like our stadium. We still have the National Stadium there. We still have the testing, at least temporarily. We may need to put some form of isolation centers in those places. We know it's going to really cost a lot, and that's why we will need to also employ or reach out to a lot of people, particularly those in the business, private entities, religious body, to team up with the government to make sure that some of this project come to line.
But the thing is, if we're also testing more and perhaps ruling out that department, we probably won't need as many spaces as we're projecting.
We've tested less than 15,000 and we're already at about 2,000. If we continue to test at the rate we are testing now, in the next 1 month, we don't know what the case is. As at April 1st, we had 174 cases. By the end of April, we had close to 2,000. In the next 1 month, trust me, with the ease that we're having now, we don't really know what's going to happen. So they need to keep, at this point, they need to start keep building more isolation centers so that we can cater for the cases that will come.
All right, we'd like to thank you, public health physician, Dr. Samuel Okerinde. Thank you for joining us on the program.
Thank you for having me.
We also have Dr. Donny Beke via Skype. When we come back, we'll also have an infectious disease expert who joins us on the program. That's in a moment. Welcome back. We've been talking with Dr. Donny Beke, a medical doctor in Illinois, the United States. Thank you for staying with us. I must ask, you know that, of course, we're easing restrictions, Abuja, the FCT, Ogun State, from Monday. And a lot of people have had so many things to say on that, even though we are witnessing more and more cases. What kind of safeguards do you think we workers especially should be looking at as, you know, they prepare to go to work on Monday?
Well, I think it's important for people to have some, personal accountability. We all know that we're supposed to wash our hands, maintain social distancing, wear masks. But I also think there has to be some enforcement of these public health measures. We really need to make sure that people are abiding by these rules. The other thing is employers, they need to help provide their employees with what they need to stay safe in their establishments, providing them masks, providing them gloves, providing, hand sanitizer so they can keep themselves safe. The other thing is, if you have a small market, limit the amount of people that are coming in, maybe limited to 1 or to 2 people at a time. Bigger establishments can demarcate what 6 feet is, because people may not even know what 6 feet of social distancing is. So these are things that they can implement very easily to help keep people safe.
Quickly, the director of Africa's Center for Disease Control said that African countries have the funds to pay for reagents, but they cannot buy them. How do you think we can resolve this, especially solidarity coming together, the African continent?
Yeah, so, unfortunately, we're dealing with a pandemic, so every country in the world is vying for tests. They need tests more and more. So I'm not surprised that, Nigeria and other African countries are having a problem procuring those tests. So it speaks to the importance of having another avenue. In addition to importing tests, it's important to maybe start looking at ways to developing our own. I know I read, Senegal is starting to create a rapid test that has been, pretty accurate. So that's something we may need to start looking into. What are our other African countries doing? Can we work together to create something for ourselves?
All right, we appreciate your time on the program. Dr. Donny Beke, medical doctor at Illinois, the U.S. Thank you for joining us.
Thank you.
Abia State government today announced that the index case of COVID-19 in the state has been treated and discharged. There were 2 patients at the Federal Medical Center, Umuahia, receiving care at the isolation facility of the hospital. The state governor, Keziek Pazo, also promised the easing of the lockdown measures in the coming days, but under strict protocol guidelines. In Taraba State, the government has ordered the distribution of food items to Muslim faithful across the state in the spirit of the ongoing Ramadan fasting. The governor who inspected the various food items also said the government has concluded plans to commence the distribution of palliatives among the poorest next week in order to cushion the negative effects of the lockdown. And the leadership of the Nigeria Labour Congress NLC in Sokoto State is calling on government to do more to protect health workers on the front line. Chairman of the Labour movement in the state, Comrade Aminu Umar, made the appeal at a press briefing where he also demanded the inclusion of professional union leaders in the COVID-19 Task Force Committee of the state for more valuable contributions and to ensuring adequate protection for their members. And also to celebrate Workers' Day, the Oyo State Governor, Seyi Makinde, has directed that salaries of all senior political appointees in the state be slashed by 50% with immediate effect. He made the announcement while addressing workers at the NLC Secretariat in Ibadan. The president of the Nigeria Labour Congress, Mr. Ayuba Waba, is warning against massive sack and non-payment of salaries by employers as the nation grapples with the effect of the COVID-19 pandemic. Speaking at an event to mark the 2020 Workers' Day in Abuja, Mr. Waba describes any form of deductions from workers' salaries at this critical time in the nation's history as illegal. He asked Nigerian workers to remain resolute in contributing their quota to national development despite the effects of the pandemic on their welfare. And so how do we manage to slow down the rate of infection? Dr. Gertie Anyanwoke, an infectious disease specialist and medical doctor, Baton Rouge Multi-Specialty Care Center, Louisiana, U.S., joins us via Skype. Thank you for joining us on the program.
Thank you. Thank you for having me.
What's your assessment of the coronavirus in Nigeria? Do you think that the numbers being reported might actually be higher or less? And that is considering the spike we're seeing in states perhaps like Kano, which speaks to previously undetected cases spreading.
Well, as you know, all over the world, testing has been a major issue. And so if you don't test that much, you may not find as many positives as you could. I know that NCDC is doing their best, and I belong to the Association of Nigerian Physicians in Americas, AMPA, and I know that we are willing to see how we can assist with any recommendations in addition to what is already being done in Nigeria. But we are aware that the Federal Ministry of Health and NCDC are trying their best in terms of testing. But like you know, it's been challenging world over being able to get the PCR testing for the virus.
Dr. Anyanwoke, you've treated some COVID-19 patients. Tell us your experience.
It's been a lot of good experiences, some not so good, especially when I lose a patient. But overwhelmingly, most of the patients have done well. I have to reiterate that majority of people that test positive may have no symptoms or very mild symptoms. And this is about 81% as we know it at this time. And so the people that are sicker are the people that we usually admit. My patients that I manage at home depends on their level of severity. I could call them, say, every day or two to check on them. They stay at home on self-quarantine. The patients that I admit in the hospital is another matter. A lot of times they are more severe, some of them requiring intubation, ventilation, oxygenation on the machine. And then that's where it's like a multidisciplinary approach. But first of all, even the patients I have at home, if they have some coughing, inflammation, maybe even mild pneumonia, I put them on antibiotics. I have a personal concoction of multivitamin, vitamin C, and some zinc. I have used hydroxychloroquine for the patients that I've admitted in the hospital, and that's because we don't have much else to go. But my patients that are not hospitalized, I don't usually place on hydroxychloroquine because majority of them have done well and without hydroxychloroquine. Some of them have risk factors, especially cardiac risk factors, and so I wouldn't want to jeopardize them that way. The patients that I admit in the hospital, if they don't have those risk factors, I put them on hydroxychloroquine because we don't have anything better. However, there has been a study that was partially released this week of remdesivir, and it seems promising. We're going to be looking into that and see if that can help our patients further.
All right, while we wait for the World Health Organization and the vaccines, we'd like to thank you, Dr. Gertie Anyanwoke, an infectious disease expert. Thank you for joining us on the program.
Thank you so much for having me.
From the Nigeria Center for Disease Control, our Muslim brothers and sisters taking part in Ramadan must observe all prayers and meals within their homes as no gatherings are allowed. This center continues to work closely with states. You can find the latest national strategy to scale up access to coronavirus disease testing in Nigeria and other public health advisories with regular updates. Also, the World Health Organization has live updates each moment about the spread of the pandemic. You can see the strategies on their website and the public health responses as well. Well, that's our COVID-19 update. Another update comes your way again at 9 p.m. I'm Minister Ntuwonka. Bye for now and stay safe.